very risky. But your risk of having a birth when you have that disorder is, you know, so you're balancing that risk. But anyway, the estrogens that we gave 20 years ago changed everybody's machinery to favor making potent estrogens and weak estrogens in the downstream process, okay? So it's a very strange error for us because everybody was getting therapy, many people were getting therapy, but you can imagine if you had the genes that were already going to break down estrogen but keep the potency relatively high in your body, if I then on top of that give you a form of hormone that makes you make even more potent estrogens, you'd be at risk for lung disease. And that is what we saw, okay? So there definitely is a relationship. We think it is less powerful now with the estrogens that are commonly given, okay? But please know that any form of estrogen therapy, if you have twitchy airways, can make it worse. And twitchy airways are reactive airways diseases like COPD and asthma. So you have to be very careful with those. And all of you are at increased risk for making blood clots. So you have to balance hormone replacement therapy with that risk as well. But I want to tell you that estrogen is a real deal, okay? So we talked about how estrogen might play a role. Let's talk about how other endocrine factors might play a role. So in the year 2000, it was estimated that 1 out of every 3 children born will develop type 2 diabetes in their lifetime. 1 out of 3. It's the biggest healthcare epidemic of our time. So what do you think is the major cause of diabetes in the United States?
Obesity, obese.
Sedentary lifestyle. Right? We were all designed to be farmers. We were not designed to have food available to us all the time. The processed foods that we have are horrible. I'll tell you, in my old laboratory when I was a basic science person, I gave rats high fructose corn syrup to make them diabetic. So don't care what the food industry says, some of these very potent sweeteners that we have increase the risk for diabetes. But what happens is if you have belly fat like an apple, your body does not use its own insulin well, okay? And then what happens is you morph into sort of a pre-diabetic state. And if you don't lose weight, you don't exercise, and you don't refine your intake of carbohydrates and sugary foods, and you don't exercise, then you can progress to diabetes. Is there any drug that's commonly given to patients with lung disease that makes that worse? Can you think of one? Maybe you took once in your life that caused weight gain. Prednisone. Exactly. So if you get prednisone and you're already pre-diabetic, you're usually going to declare yourself as having overt diabetes. It's going to push you over, okay? Now, when I went to the Pulmonary Hypertension Association and we did waist measurements and body mass index measurements, if I were to tell you that 1 out of every 3 persons in the United States is obese, how many patients with lung disease do you think were obese? 75 or 80%. Now, most of them, if you ask them, are you obese because you can't breathe and nothing else matters, right? Yeah, well, my doctor's going to tell me to exercise. I can't exercise when I can't catch my breath. That's unrealistic. But if you ask them about their weight prior to their disease getting so severe that they couldn't exercise, they were heavy. And they came from heavy family members. And the way you gain weight is absolutely genetic. If you're an apple, it's much worse than if you are a pear. I don't have a whole lot of time to explain that, but trust me on it. So there is something about being heavy that makes lung disease more likely, okay? And the thought is, when you get a belly, that fat is different from any other fat that accumulates on your body. And that fat makes inflammatory chemicals, inflammation. Do you think your lung disease is made worse if I give you yet more inflammation in the body? Yeah. Absolutely, yes.
Can you define inflammation?
Okay, so there are chemicals that float around in your body, hormones and others, that are really there to help your body fight off infection. That's what that's what they were designed to do. But these same chemicals can be revved up when you have central fat. And what these chemicals like to do are to make your blood vessels squeeze down in the lung, recruit a lot of your immune cells that fight off bacteria and viruses, and they get angry and they make your lungs more twitchy, and that's terrible for COPD and asthma patients. And then the other thing that they do when you have a lot of inflammation is that it drives your regular blood pressure up. And then lastly, it makes you more prone to have clot, like a pulmonary embolism or a deep vein thrombosis. Okay, so just having obesity has lots of implications regarding diabetes, but please understand that obesity also causes a lot of other problems with this kind of chronic inflammation, these chemicals and cells that are all revved up that cause noxious things to happen in your body. Now, do you think there might be another common underlying disorder that results in pulmonary hypertension or is present in many other forms of lung disease that coincides with obesity and central obesity? And I have heard people talking about it today, and I'll just go like this. Sleep apnea, okay? So absolutely, absolutely. If you are heavy, you are likely to develop obstructive sleep apnea. If you have not been screened for sleep apnea and you are heavy, that is a bad thing. Because if you have obstructive sleep apnea and you don't fully breathe in and out at night, then that causes more inflammation in the lungs, increases the right-sided pressures, and has all of the bad sort of end-stage complications that other lung diseases can have. So it is important that you are evaluated for that, okay? So obstructive sleep apnea, obesity. Now there is another endocrine disorder that appears to coincide, two other endocrine disorders that appear to coincide with obstructive sleep apnea. Those are hypothyroidism, okay, and low T. So I spend about half my clinic prescribing T after trying to talk testosterone, about having to talk to males about whether this is really a good idea. But when you have obesity and you have obstructive sleep apnea, your testosterone usually plummets. So that's just something for you to realize, that there's an intimate relationship between obstructive sleep apnea, hypothyroidism, low T, and obesity. They all run together, okay? So, a couple of other things that we wanted to talk about. Let's go back to the estrogens. So, estrogens may have played a role in the development of your lung disease. There is remember I was telling you that your body breaks down estrogen into potent and non-potent forms. When I went to the Pulmonary Hypertension Association, in addition to getting information about how long people had been on hormones, what their exposures had been, and the vast majority had greater than 10 years exposure, I actually did a special urine test that I sent to the NIH to measure their degree of potent versus non-potent estrogens. And what we found is the potent estrogens were high and the weak estrogens were low. Weak estrogens inhibit this process. Okay? So if you have too much bad estrogen and not enough good weak estrogen, this process is made much worse. So what we began doing in my laboratory was actually giving an anti-estrogen or weak estrogen, one of those byproducts that people with lung disease don't make well. And we gave it in culture, and we gave it in animal models. And I won't go through all the specifics of it, but just trust me that particular weak estrogens, anti-estrogens, may actually have a role in the treatment of lung disease. So in the next 10 years...
Without regard to sex.
Huh?
Without regard to sex?
That would be an interesting question. Because, that would be a very interesting question, yes, probably.
What was the question?
The question was, could these weak anti-estrogens ever be used in men? Probably. Because they're being studied in heart disease too. Men get heart disease to a much higher degree until women go through menopause, and then the rates approach one another. So the idea was, well, maybe we need to give them estrogen and they won't have heart attacks. Those trials were done years ago and men did horribly. But what they're probably missing is the weak estrogen. So cardiologists are looking at giving this weak or anti-estrogen, and I'll just give you the abbreviation for it, 2-ME or 2-methoxyestradiol. Those compounds appear protective for the heart, appear to improve lung disease, and so in the next 10 years you may see them as an actual therapy for lung disease. So the estrogen tone is really important, okay? We talked about obesity. So how do you lose weight? What are things you can do? Because you have lung disease and many of you guys may have what we call diminished exercise capacity. So the important things are really common, like the soft drink choice that you have, the drink choice that you make every day. So if people will eliminate soft drinks and sugary beverages, the average weight loss that occurs is somewhere between 10 and 15 pounds. So that's a very simple change. The other thing is white stuff. White stuff ain't so good. So if you, so if you eliminate white bread, pasta, rice, high carbohydrate foods, you will lose weight, I promise. Now, I don't like to endorse particular diets, but if you look online at diets like South Beach and even a new term called the paleo diet, which has complex grains, some proteins, low salt, fruits and vegetables, that diet is really the best for losing weight. And certainly any significant weight loss when you are obese is going to contribute in a positive way to your lung function.
Still paleo?
Paleo is P-A-L-E-O. Okay, that's kind of like when we were hunters and gatherers, how we ate. Okay, go ahead.
More so than the Atkins.
Yeah, so there's a little bit of a problem with Atkins. I love it. I can lose 20 pounds in about 2.5 weeks on the Atkins diet.
I've only been on it 4 days and I've lost 4 pounds.
Yeah, so there's one problem about the Atkins diet, and that is that they let you eat pork rinds and stuff that's really high in salt and fat.
I've eaten those, yeah.
Yeah. Some of the things that they tell you to eat in the Atkins diet are really heavy in fat, and because most patients who have lung disease have had or are at risk for coronary artery disease, like heart attacks and strokes, that fat content in the Atkins may not be ideal. But that idea that you are limiting carbohydrates, and the carbohydrates that you are eating are more complex, like oatmeal and nothing white, is a really good way to start. Just avoid some of the stuff they tell you, like use whipped cream on your whatever in the morning, other fatty stuff. So, and you could even look at the comparison of South Beach and paleo and the Atkins diet and see what are some of the overlaps, and those are the key themes, all right? The other thing is if you are heavy and your obstructive sleep apnea is treated appropriately with a nap, and that is that you're getting restorative sleep and you're not waking up a gazillion times.